Thanks, Derv. Good morning, everybody. Fergus Dolan here from NALA, the National Adult Literacy Agency. You're all very welcome to our webinar this morning on making health literacy everybody's business. We've two speakers this morning. Helen Ryan is from the Adult Literacy for Life office, and she's going to be talking to you about health literacy for organizations. And Michael Power is a literacy ambassador. He was a literacy student with Tipperary ETB, and Michael's going to be talking about health literacy from his own personal point of view and from a professional point of view in work that he's done. So we'll start off with Michael. Hi, Michael. Would you like to unmute and start?
Good morning. Good morning, Fergus, and good morning to all. It's great to be here. Thanks very much, Fergus. As Fergus said, a literacy ambassador. I'm from Tipperary. I suppose I'm here just to give you, I suppose, a little bit about my journey and how my literacy difficulties and how it all developed and how I progressed in life. And also, I dip into a little bit health literacy with my own family and the way things happened. And on my journey, as we go along, I'll tell you, you'll see where I've come from and where I'm coming from now, I suppose. I said, Michael Powers here is my name. I'm from Tipperary. And look, I left school in 16, 17 years of age with very poor literacy skills. I suppose back in the day, I was a little bit of a renegade going to school. And yeah, look, it was back in the day, but I made great inquiries when I was looking for a job at 17 or 18 years of age. Any job that was going, that was a manual job and there was no reading and writing involved. And back in the day, that's where you got away with it. And I'd done that for a good many years until I met my wife. And yeah, we got married and I had two kids. And next thing, it became a reality that I wasn't going to be part of my kids' upbringing if I didn't do something about my education. And yeah, it was a big thing for me. My wife then, I had to tell my wife, and she didn't realize it was quite as bad as it was. And she got in contact with the local literacy scheme near me. And I went in an October night to meet this woman. I had reading and writing difficulties to tell her. And as I said, she sat me down. She talked to me. She didn't judge me. She didn't... she never judged me. She just talked to me and asked me about who I was, where I was. She never introduced a Ladybird book like I thought she was going to. And that was the gate that opened my whole new life into my journey as a literacy learner and now a literacy ambassador. And from that, I suppose, even going back every Wednesday night and over a period of time, I remember we'd done level 1 certification and it was a huge thing for us at the time. And I suppose the big plus was I was able to sit down and be part of my kids. I was able to read the story to my kids, be part of their upbringing. And even I'd done my Leaving Cert at 39, and a year later, my daughter done her Leaving Cert, and she came out into the yard and I was cutting with a chainsaw and asked Daddy, come in and give me a hand with me algebra. Now, that's a word I didn't know what it meant. And the reward for me, I looked at her going in the back door and I said, this is why I went back to education. But prior to that, when Michelle was a year old, it was one of from a health literacy perspective, she wasn't thriving, her hair wasn't growing, and we had her in a couple of different hospitals. We were in Limerick for 3 or 4 months, and there was no, they couldn't diagnose what was wrong with her, and she wasn't thriving. And it was a kind of an unknown to me going into this territory of hospitals and doctors. And it felt like you were on the outside of the box. My wife would be educated, but she was still baffled. But I remember we went to Temple Street, and she was diagnosed with kidney stones, and she had to. I remember we were in Temple Street one day, and next thing she was rushed down the stairs. I was in the reception area. Mary came down, and the nurse said she was going for a little trypsy. And I out the door and into a taxi and up to the matter. I'm there standing, and nobody left me in limbo. Mary was gone with her, and I'll never forget that time. There's so many things run through your mind. What's going on? And there's that kind of thing about being stupid, to ask. But it worked out. She was getting the kidney stones were being blasted in the martyr. If then he said that, it's and even many years later when she was. Michelle got her kidney removed when she was 18. She's 33 now. And I remember what we were in, and she said the doctor said she had to go for a nephrectomy. I'm not sure if I'm pronouncing this now. I asked Mary last night, what was that? And that kind of language is just, it bamboozles people. And it's amazing. Yeah, look, when you get to an age and you have 2 kids, and as I said, I was wild, and these were your pride and joy. And next thing something like this happens and you don't understand what it is, it's a horrible place to be. And I, like that, you would swear now what I'm saying, but our son, when my son is a year older than Michelle, and when he was 7, he woke up here one night or one morning and he wasn't able to walk. Now he's a big chap, and we rushed to Tullamore, and we remember being in the A&E, and there was a crowd around him, and they came over. A nurse came over and said that he had slipped the pivotus. And again, Mary looked at me, and I looked at her, and Mary be educated. And it's gas, even, it's not about education, it's about the languages which are being used. And until 20 minutes later, another nurse came over and asked us, do we know what it is? And she explained his hips have slipped out of place, and it happens to young children, but more 15 years of age, not 7, because you're growing so quick. But if that had been explained to you, it would have meant all the world. But and again, another situation, I suppose, it's a few years ago. I went for to get the prostate checked, and the specialist said to me, "Look, you have to go for a colonoscopy." And I said, as again, a few years ago, because of my involvement with NALA and my understanding, and I suppose not having that fear, how would they say it? You go back to education. When I grew up, I was always told that you were stupid, you'd never be any. I was told one time in school that you're working class and that's all you'll ever be. And that sticks in your head, and people have an embarrassment and shame. But I met this woman when she was telling me about colonoscopy, and I said to her, "Look, I'm an ambassador for literacy. If I said to you, I had a reading and writing difference, what would you do? You're telling me I have to go for a colonoscopy." I'll never forget it. The best description. She got an A4 page and she drew what was going to happen. And she showed me that. And I said, if you never said a word and you showed me that, the old saying, a picture speaks 1,000 words. And it was just, and only I was talking to lads before, and I had a doctor's appointment yesterday into my doctor. Not major, but what did she say to me? She was saying something about, do I understand it? I know her well. I said, Mairead, you know well I have literacy difficulties. And that it just changed. She just explained to me in layman terms what was happening. And she knows me of old, and I always go in, and it's lovely to be able to go in and have that conversation about something. It could be a personal thing, a pain, or the personal thing of not understanding. We were talking about earlier on your medication and not having that shame about it. And it's wonderful you go into somebody before the first time you go in and they understand what that is all about. Not everybody understands. Not everybody understands the lingo of health literacy and all. Out of my journey back to education, I done my leaving cert at 39, as I said, and part of my journey was to do work experience. So I was very interested in getting back into the intellectual disability centre. So I just done voluntary work for a while, but I eventually I'm after spending the last 15 years full-time working with people with intellectual disabilities. Again, that's, for me, I'm going into a center where people have, as I said, intellectual disabilities. And I also myself felt that I was going in, after coming away and discovering that I had a disability with reading and writing. So I connected very much with the clients I was with, and I advocated for the clients. I advocated, and we done hospital appointments from time to time. And I'd always remember one lad to get his toenail off, and we rang the hospital, and he'd be challenging. But because of where I came from and where he was, I connected with the boys. So I explained, look, we need sedation when we get in, because his attention span is very limited, and just have everything there and it'll work. But it's just phenomenal when we arrived in. There was nothing ready, nothing set up. Instead of having it done everything would have worked A, B, C if everything had been put in place. We ended up there for 3/4 of the day, which it could have been only an hour. And it's gas. Another guy we worked in the house, we had a high support house, and he went for what did he get? He got a big operation on his eye, and he ended up in Limerick, and we had to go back for, I think it was for about 3 years we're going back. And I remember one day in the early days, the nurses were there, and they were, because he's not used to the hospital setting and all that, and they were trying to just put in drops in his eyes, and they were trying to pull him and dry, and Brendan was getting all, and he just couldn't. I just said, girls, hold on for me. No, Brendan, I said, just pull down your eyelid like that, and you help the nurses. And he was just so delighted to be involved. And every time in the house from that day on, and still is, you just tell Brian, pull down the eye and you put in the drops. And it's just being part of it, and not, it's like everything. It's just talking to the person as a person. And it makes such a difference. And look, I know my parents, I'm thinking of this only this morning, that my father and myself, we wouldn't have got on, but down through the years. So back in the day, we used to come down in the morning, and he'd been a heavy man. He had ulcers on the legs down through the years, and you'd see a pool of water on the ground, and he'd be there, and nobody'd say that, nor would he say that. But he eventually, remember, he went into hospital, and he had to be rushed in by ambulance, and the doctor told us that the possibility he could lose the leg, and he did within 6 months after that. But I always want, and a story I always tell, and it's just related to what I'm doing here this morning now, but I used to take him into clinics in Limerick, and I was driving past the centre. I was doing a talk similar to what I'm doing now about literacy. And I just said that I went there a few weeks ago or a month ago, whatever it is, to do a talk. And God, he said, I tried to go there. I nearly crashed the car. I'd never had that kind of conversation with my father. But I questioned him, and he tried to go back. I'm the second oldest of 7, and there was only 2 of us born. And he tried to go back 40 years prior to that to do something that I had done. And he got cold feet and walked away. But then things clicked in my mind, and I said, is it his health? I was thinking of his leg, and I said, he went into clinics and he never wanted anybody to go in with him, and he'd be very deaf. And was he ashamed that people might learn that he didn't understand what was being said? And I look back now and I say, the man, it was to do with his lack of understanding. And maybe he could have kept his leg if he had understood more. Or this is what happens. There's people, the people, older people in particular, and me having literacy difficulties, I speak to lots of people, and the person it's amazing the amount of people who engage with you and they know that you've walked that walk, you have reading and writing difficulties, and say, Jesus, I'm like that. But I wouldn't have the balls to go back and do it or what. And it's to spot that thing. It's to spot them little things that people mightn't have glasses. And like I went giving blood there a few months ago, and I've often said it to blood donor clinics when I went to. There's a lot of people. There's so many people in Ireland that have below average levels of reading and writing. You should make to be nice if you could do something about that and maybe make it an easier access for people. But I was in giving blood recently and sitting down and I was registering, and the guy came in behind me and he hadn't obviously given it in maybe a couple of years, so he was back. And anyway, he said, that's no bother. The guy said, look, we'll register. And he says, and he was getting the paperwork. And my man beside me said, I don't have glasses. Oh, God, that's no problem, he says. He reached behind him and pulled out glasses out of a box to give him the glasses. My man froze on the seat. It wasn't the glasses was the issue. It was the reading and writing was the issue. Because I knew the chap and I knew he had problems. I knew he was from town and I knew it. And I had my blood given and I was heading for the cup of tea, whichever takes an hour. And he was still just gone past registration. Now they were helping him. But you see how difficult it made for him and the embarrassment. And I heard it, and anybody coming in behind me, and it people don't realize when you have difficulties. The last thing I remember when I was back in a group of 8, we were in class. There was one guy who was traveling 20 miles, and there was a literacy center in the town he was from, but he traveled 20 miles away so nobody would know in case he met a neighbor or a friend. The embarrassment of it, and it's about making that transition when people come into a health center. I always maintain it's the people. If the people in centers understand, they'll know and they'll see it and they'll just soften the blow, whatever it is, and make it easier for people. I often wonder. My father. I don't. Whether it was ignorance or just, I don't think it was. I think it was just pure shame. He came up in a time and he couldn't. We all got on. I had Jesus. It was astonishing to think I ended up with literacy difficulty, and he tried to go back 40 years prior to that. And yeah, it's something that will live with me for a long time. And that's one of the big reasons I do what I'm doing here. And as I said, I worked in an intellectual disability centre in St. Anne's in Roscrea, and I remember they sent me in for a medic. You have to go for a health test before you get the job. And I went in, and I was waiting in a clinic in Limerick, and a guy came in beside a lot younger than me, and they give you this 3-page document. I say tick boxes, and if you opened it once, you opened it 20 times. It's typical. You'd see it, you know. And he looked at it and then looked at it and looked at it. And I went in. The first thing I said to the doctor, I said, "Sorry, I'm an ambassador for literacy," and I explained. Oh, geez, he says we'll do something about that. And lo and behold, I'd say about 3 years later, I had to go in for another medic, and the same sheet tick box thing was still there. And I said to myself, what the hell, it's about making, we do, look, society, I think, we make life harder. I do believe the education system, I loved it, and I'm on a high. I went back, I got a leaving cert. Within the Intellectual Disability Centre, I done my VTAC level 5 in intellectual disability, and did I ever think I'd get that? But everything is just, there's no such thing. I suppose at the road I come, and I went back to education. I'll be leaving cert at 30. And I remember asking, there was a guy who done research on literacy a few years ago, and I was at the talk, and I said, excuse me, did you ever, I got 30 years I worked and I lived in my own community. Did you ever look to see what I brought to the table when I went back to education? What I picked up in that 30 years? And God, you said that study was never done. Just because people come in and have this shame and not being able to write doesn't say they're not clever people. The maneuver and how they maneuvered around and get around these things, it's fascinating. There's educated people said to me, man, Michael, I won't be able to do what you've done. But now I'm on that ladder now, and I don't have the shame, and I'll shout it from the treetop that, yeah, I'm glad I went the road I went. But I advocate what we're doing here today is to, especially in the health sector, it has to be made easier. It has to be made easier for people. And there's a guy, that finished up work, retired early because of bad health. And he asked me, he wanted to become a literacy tutor. So I got him into the centre and he done the training. But he himself got cancer. And he was there's a centre in where I'm from, and there was the coffee morning. And he used to go out there on a regular basis. You meet other people, have the chat. And he told me, Michael, I went in one morning. There was a girl in the kitchen and she was rolling crying. And he says, she had all the leaflets and she was after being diagnosed with cancer, but she couldn't read and write. Imagine she went to somebody, diagnosed, and got the literature, and nobody's seen that. And what did that girl go through? It's bad enough having something wrong with you. Like me, the colonoscopy, I didn't know what it was. But to drew the picture, a simple thing, it wasn't rocket science. And I said no words were needed if I had got that. And it's just, I know things are the way they are, and I know I'm long enough around. There's no magic wand to change it, but it's tiny steps, and before you know it, you'll be running if you only take tiny steps, and that's all. I'm passionate about. I'm passionate about it. And I know even in my job, I worked 15 years in challenging behavior, and I really did think I was going to change the world. And I learned very quickly it doesn't happen that simple. And I changed people's lives. This is just how two guys would be very challenging, and they were going to your specialist and your special, and that's all brilliant. But for me, it's all about it's all about inclusion. I want people to be included in society, in the health. So I included two boys I play in a brass band. They came to the brass band. One came with guitar, and another fellow came with his cymbal. And he sat down with guitar and a brass band, and he'd be very agitated. So I said to the lads, one by one, come over and just introduce yourselves. Jeez, he turned around to me, Jenny and Michael, they all know me. The agitation was gone. Like, that's what I'm saying. When you meet people, it's the way you greet them. And he was on a high. And just outside this, and he played a guitar and he can't read music, but he just was so focused on what he was doing because he was included. It's all about the people that come in that just want to get better, and they just want to know what's wrong with them in plain terms. I'm not going to say a whole pile more because I know there's other people here to say a few bits of words, and I hope I didn't go on too much. And it's a pleasure being here, and I have to thank the lads here for having me on today, and maybe we'll get a chance to talk later on. Thanks very much.
Michael, thanks very much. That was really powerful, and as someone said in the chat box, inspiring. All your examples from your own personal life and from your professional work were just so relevant, and it make people think we need to change the way we offer health services to make them more open to people who might struggle with reading and writing. So,
well, one other thing, Fergus, just to say, like, look, as I said, my daughter is now 33, and unfortunately, she was diagnosed with MS 5 or 6 years ago. but I just only this morning I just kind of asked every day, every time I do this, there's something new comes in. But she's she was there with me when I was only going back and she was young and is very supportive. And when she got older, she wanted to be a literacy ambassador, so she done the training. But this is the reward for me. I see her now with her medication, and she's so up to date and so understanding of everything she's on, and she has the names, the dosage she's on, and she's able to ask the questions to doctors. I listened to her a few times. I don't know if it's the journey I done. I just made her more aware, but to me as a parent, that's my reward. That I like to think that she picked that up on the way, and that's what we want. Just people to understand. Not everybody can do that, but I suppose it's the front line. The people, when you meet people, it's just to think. It, don't judge people. Never judge who they are. You have to talk to them and try and understand them. Right, Fergus?
Thanks, Michael. You can have a look through the chat box, Michael. People really found it inspiring and informative what you've said. So thanks so much. That's great. Hopefully at the end we'll have a bit of time for questions. So our next speaker is Helen Ryan. Helen is the health lead in the Adult Literacy for Life program office, and she's going to be talking about health literacy for organizations. So over to you, Helen, and all the best.
Great, thank you, Fergus. Joys of technology now, trying to let me in here. And let me see. Okay, it's choosing what, it's not letting me share, but anyway, look, I can send it on, we can sort it out in a minute. So I'm going to start looking and talking about health literacy, numeracy and digital literacy in Ireland. And my name is Helen Ryan, as Fergus said, and I am working in the Adult Literacy for Life programme office, based over here in Solis. So people are probably aware of hopefully the Adult Literacy for Life strategy, which again we'll talk about and share in a few minutes. So I will suppose the first thing to look at is what are the definitions of literacy, health numeracy, and digital health literacy now, because I suppose this is a big issue for people because the digital side has thrown it in since COVID has come along. So the main pieces around, I suppose, it's focused. If people would imagine, what do you think health literacy is? Well, it's all of the information that you would work on around in the health literacy world. So thinking about the material, Michael, you've already mentioned some of the things there. I think around leaflets, information that's thrown at us, letters from hospitals, and so on. We then have health numeracy. So the Americans are great. They've done a lot of work and research on health numeracy. And that's really, again, Michael brilliantly explained to us about medications. So that's where you do different things where you might have to work out something, or I have an example funny on one of the slides. My biggest bugbear is an anti or a cough bottle medication called Exbutex, if anyone has ever taken it. And in the instruction in Exbutex, it says, take 15 mils 3 times a day. And for anyone familiar with taking medication, again, I made an assumption once that every person in the world knows that in bottles of medicines, you get a thing called a spoon, the plastic spoon. And I was chatting about the spoon and the mils to somebody who genuinely actually, I think, thought I was going mad and couldn't understand what I was talking about. And they said to me, what are you talking about? Spoon, teaspoons? But I said, no, the spoon that you get in the medication. I'm like, what spoon? And it was genuinely this. That's fine if people don't thankfully ever need to use it or don't take cough bottles and stuff. But again, assuming that. Anyway, take 15 mils 3 times a day. So the spoon is in 5 mil and 2.5. So you've got to get your maths out. Your 5 into 15 is 3. So I've now to take 3 spoons of that 3 times a day. Really, really confusing stuff. So I think the health numeracy piece, there's an awful lot of numbers around our healthcare. So we do have to look at that. And then the final one is digital health literacy. So I think we're all sort of familiar with the way the digital world has moved us. And as I mentioned, COVID has certainly thrown us in. But things like prescribing is coming down the line now, telemedicine. Lots of people are using wearables and checking between their heart rate or their steps. So, and it's only going to get, I don't mean to call it worse, because I think the digital space can offer lots of advantages as well. But I do think there's only going to be more pressure on us as consumers of healthcare, patients, trying to sort of navigate our way around digital health. And so we have to be very aware of that. So after sort of thinking about what are the definitions, and I mean, why would we be working on sort of health literacy? Well, it's about taking us from a sort of a bit of a confused state. And Michael, you mentioned it there very well about sort of all that bits that you're trying to work on and do into a sort of a really clear way of understanding your condition. Like you mentioned about Michelle, I know what I have and I know what I need to do, and I can make informed decisions around that as well, I think, which is really important. So health literacy has sort of three different sides. So it's split into, this is according to the World Health Organization. People might be familiar with personal health literacy, and then there's organizational health literacy. And finally, there's a new term that I'm calling community health literacy. So personal health literacy is where we've heard from Michael speaking there, or me, or Derv, or Fergus, any of us that are trying to engage with health services. How are our skills when we go meet those services? You know, if they hand me a leaflet, how am I going to find reading and understanding it? If Michael gets a new prescription, how's he going to be working that out? If we get an appointment that we have to confirm online, how is our digital skills to do that? So that's the personal side, is our own skills with what we have to do. The organizational side, which is, and so sorry, for many years, it was all about how's Helen's skills going in? You know, how's Michael's skills? That was it. And didn't think about what we're being met with. So the organizational piece is brilliant because it flips it the other way. It can't, because there's a bit of blame too about it's you that has to be perfect coming into the system. Well, no, that's not life. We all don't have brilliant sets of skills in everything. And what do the organizations meet me with? So take a hospital, for example. If I go visit a hospital, how easy is it to find the department that I have to get to? Was there a map given to me in advance and really good instructions to get there? When I got there, was the person really nice and kind to me on the desk? Did they, if I had to fill in a form, did they consider that I might struggle with that form and maybe ask me, would I need a bit of a hand? When I went to meet the doctor, did they speak to me in plain language? Did they, exactly the great point you made, Michael, about jargon, did they engage with me in a way I understood? Did they hand me a leaflet that was written in plain English? Could I understand it when I left? And did they check in and see, did I take away, whatever the takeaway from my appointment is, did they check that I understood that? So there's a lot going on in that world from an organizational side. And that's a really interesting piece. And there's a lot of work in, I suppose, at the minute, American research, as well as other countries like Canada, Australia, and then the European side of the world as well. And the England are very strong on this around the organizational health literacy. So there's a lot happening around trying to work with organizations to become more literacy friendly. And then the final one that I'm calling community health literacy. What's that? Well, it's about in one sense, I'm not sick yet. You know, so the other two we've just mentioned, personal is I'm going in because something up with me and I need to get seen to. The organizational is the services I'm meeting. And I'm flipping it in. The community health literacy is, well, you know, I'm in my community and maybe I'm a smoker and there's a quit smoking class on. Oh, maybe I'll go in and do that. That's a community health response. Or the government has invested now hugely in the Healthy Ireland initiative and in 31, what are they, healthy city and county coordinators around the country. And that's 31 of them sit in each of the 31 local authorities. And then Sláinte Care, if people are familiar with that terminology, that's another strategy. There's 19 Sláinte Care staff put into particular areas of, I suppose, disadvantage or areas that need particular resourcing put in. So there's actually the 19, there's my maths, 19 and 31, there's 50 staff funded, you know, through government funding, but not directly, through the HSE, that are out working on the ground on community work, community health work. And I think health literacy has a focus in there. So as all the community work happening, and only a couple of weeks ago, we were down meeting the community healthcare CHOs, you know, these community healthcare organisation, Region 5, and it covered actually a couple of counties. And we were speaking there, we looked at some of the posters they had, and really interesting. And one of the posters, for example, had a really, and it was, I'm sure they'd be okay with me telling this because we were in a room of 40 people and I was with the poster up and I read out the email, and the email address was something like, quit smoking, Southeast at, and I was like, you know, any of us even, no problem doing that. I would invariably get something wrong in typing in that length. Like that's a far too long email address. And we had a good laugh. In all fairness, everyone had a bit of a giggle and went, "Oh my God, I can't believe we did that." So it does just show you that it can equally happen around, I suppose, all of us do things in our daily life, and until you maybe sit back, and I think Michael's talk, which is always hugely informative and inspiring, always makes me see things differently. So you put that literacy lens on it and see it differently, and that the community piece, I think, has a real opportunity there because they're meeting people. To me, and I'm working up in we're linking in with Summerhill primary education links in there, and really interesting when you go and you chat to people who are working
Helen,
on the ground.
just
Yeah.
that community thing. Yeah, I'm very interested. As I said, my first night come back to education, meeting that teacher. It's that person coming in with that person would be, to me, it's like me going in with a health issue. It's like that person, they feel the same way as I, the nerves, and it's the engagement. You're dead right what you said. That first engagement is so important. It's what
Yeah.
it's all about. And I can't underestimate. I can't describe that strong enough. That engage, like for me, that woman that I met when I went in reading writing. How are you, Michael? She wasn't there to judge me. She wasn't there to find out any. She just said hello to Michael, set me down, talk to me. For if there's any three sentences, just talk to her. Lovely morning, how you feeling? It's amazing that it's so simple. It's not funny, that little thing, and that actually, that introduction, that's so powerful, and it can change so much in them few minutes, and I can't highlight that enough in everything.
Yeah.
Sorry now for
No.
interrupting you.
No, yeah, Michael, you're so right. And I mean, I suppose we're here today with this is the community and voluntary sector with others there. I mean, I'd say there are some healthcare people here as well and people working in NGOs and different things. But it is, I think, and I do a lot of this training over the years. So to say, I mean, I'm on secondment from NALA over for 3 years here to work on health literacy in the national strategy. But and all of the time, Michael, you're so right. I mean, it really does boil down to just we're all human beings, and a lot of the training I've done over the years, it's basic down to respect and how are you, and no matter, because you will never know who arrives into your door whether they may have any issue. This stuff isn't, there's no distinguishable item that I'm wearing that might say I'm not great at the forms. Or I struggle with reading leaflets. So we have to look, and we look at that in a minute on the universal precautions piece in a tick. So Derv, thank you. You have the slides there. So if you want to just move on to the next piece after of course, so I was only just going to wonder then, did people have any idea how many adults do you think have limited health literacy skills? So people could maybe throw something into the chat. We'll share with you that possibly you might know that 1 in 6 adults struggle with reading basic information. So that would be a health leaflet. 1 in 4 would struggle with numeracy. So they're the official OECD statistics. So what do you think about limited health literacy? Anyone? So Adrian is saying 60%, 4 in 10. Maeve, yeah, 30%, 40%. Yeah. Okay. So funny, the fact sheet that we think is up on the NALA website, which we wrote a couple of years ago, does use the old survey because the new one is coming. And I suppose on the next slide, John, you're saying 80. God, John, now well, hopefully we're not that bad, but we'll on the next slide we'll have a look and see. It will share with you, reveal the actual figure and the data that we have heard about for the last 2 years from our colleagues in the Department of Health, but the report will be officially launched in spring 2024. We actually have 28% of Irish adults have limited health literacy. So what does that mean? Well, 28% means it actually joins the two of them there. So when we'll have a look in a minute, the problematic and the inadequate brings it up to this limited health literacy. And basically what that means, and the survey results are showing that people are struggling with finding information, first of all. So that's interesting. Where do I get it? Where is it? And then assessing. So when we say literacy needs as well, we're not talking about people who can't read and write anything at all. We're talking about people who it's the fluency possibly, and it's the understanding piece. And that really came across in Michael talking to us there, because the understanding piece is really important. And that's the 28.4%, which means, and this I do a
But
lot of
Helen,
training, you say,
sorry,
yeah,
yeah, just it's important to the percentage is something else, but you take the population of the country and you put that into figures. I mean, I don't know how many Crow Parks that will fill. It's just phenomenal. When I like the percentage, it maybe is where I come from. I like to see the figures and the numbers of people, and it's just phenomenal.
mm,
Phenomenal. People, the percentage people look at it, but they just don't realize it's yeah. As I said, Crow Park was 80,000 people, and
yeah.
it's yeah. You put it into that context, and it really opens your eyes what we're talking about.
Absolutely, Michael, and that's, and as I say, just in working with hospitals or primary care centres or pharmacists or whatever. I mean, I always say like 3 out of 10 people today who come in to see you, or if you saw 100 people in the day, which a really busy GP practice can do, that means 30 out of the 100 that you see have just left maybe out the door, and they wouldn't fully understand maybe what you've asked them to do, or what they might have to bring back with them next week, or what goes on. So it really, it's a worry. And so I suppose to also say that there is, and I looked this up. I was talking to someone yesterday. I read a recent US report that said about 1 to 2% of the annual health budget is going on low health literacy. I want to do now. When I spoke, as I met some colleagues yesterday, and they sort of, the reason I don't have anything on it yet there is what I want to see. She says, "Oh, American studies, we just need to check." I said, because she'd heard a much starker figure for Europe of possibly up to 10%. So I was like, okay, look, I need to do a little bit more drilling in here before we put up some claim on the budget. So we wouldn't have an Irish stat on that, but if that's an international statistic, certainly we'll look at that. So it's costing money. So for this reason, I suppose, and just maybe on, we look at that now in a minute around the strategy. You might say, what are we doing in Ireland to address that? That is really why there's a business case, all and well. We need business cases to get things moving, but there's really a society case here, and a case of humanity, that we need to support people with the literacy needs. And the services need to be much more literacy friendly to encourage and engage with people, to be healthy, stay healthy, and if they do get sick, let's hopefully get them out the other end of that. So the next two, I know, Dev, we're probably on our technological joys this morning. The next two slides, and Fergus is going to send all these on to you, give you some extra findings to that great report. If you like reading big reports, it's over 100 pages, this report, when it comes out in the spring. And it has lots of details in it. So again, people can certainly drill into that. But groups there, someone already, I use these slides from things people are going, God, younger people, I wouldn't have thought that. People there you see with financial difficulties, so health literacy and financial are quite linked. People who have poor social support. So there's a lot of stuff for us, I think, to really look at where we need to resource and invest in sort of some projects around that. And then the next one actually has a nice grid or a graph, that actually shows you what this is probably meaning in reality. So it's meaning that people with lower levels of that general health literacy are presenting more frequently to services. So there's your business case straight off that. But also, they are the real worrying side of people having more chance of not presenting for screening. Therefore, they're coming to the health service at a later stage, so therefore there's less chance of them. That's very in the fact sheet, if anyone has looked at it, and people sort of give out. There's a little and it's very hard to say this, but people with health literacy needs are dying younger. So we have to take that into account, note that, and say if we want to live longer and our health service, because that's our biggest concern in lots of countries at the minute, health services, including our own, are under high stress points. We have to ask the question, are there ways and means of some of the people that are in there maybe not having been in there if we'd have done other things earlier on? So Michael, I thought your example of your dad, really interesting around that, and tragic pieces, and I'm sure
Yeah,
one of many
look,
stories.
and Joad Hills, have to say, I was handed his leg to bring home to bury it, and that kind of sticks in my head, and I says, you know, that shouldn't have happened. I know now. Look, it was out of my control. It was in another generation before me, and it came on, and it was. I suppose now I can say it was Nick or nothing. I might have gone. I might have been the next generation if I didn't get the help the time. But I was lucky enough. I went back, but yeah, and it was just an eye opener that I didn't know them things until late in life about him, and it just kind of now when I'm doing this, I thinking back and I say, yeah, geez, look at them people, and there's so many people like that are suffering unnecessarily because of shame of the whole thing, and everybody just look. Everybody takes reading and writing for granted or understanding things. But nobody wants to say, oh, geez, I don't understand that. They don't want to be, and they do. I know I've heard it, and the word I don't like use, and I taught it myself, and they don't want to be stupid. And that's it. And it's so important that, yeah, look, I love meeting people. I talk to people, and I'm not blowing me up, but I think now I have a handle when I meet a person, I'd have an idea, and I talk and we bring it around, and the conversation comes up in a nice way. You don't. The one thing you don't blurt it out to people. You have to work around it, and I'm at this. I've got great opportunities with Nala down through the years doing all this, and I've learned so much, and that's what we do. And the amount of people when they hear you and they want to help themselves, and down through the years, education, I had people ask, was it hard? They have a fear, and a fear of being, what is it? Different, not by not understanding. And then there's the fear of the person you're saying to, will they look at you in a different way? Or will they, yeah, that's the big thing.
Yeah.
So there's all them fears are there. It's just highlighting, look, I've been around and we've talked about this in different sectors down through the years with different learners, and all these things would have come up. Look, I'm gone beyond that now, and it took me a long time, but that's why I'm here, I suppose, to be able to tell that story, to help people to understand maybe how to overcome these things in a small little way.
Yeah. No, absolutely. And I suppose, yeah, Derv, you can move on to the next one. Michael, we would, and I'm actually going to do a slide like we're the experts of our own body. Okay, we a couple of points for people working on the ground here or working with anyone in the community, and so I've gone in and we do a lot of health literacy talks over the years, and particularly we worked a little. Nala's done a great work in prisons recently, and we were in giving health literacy chats and talking, explaining to people, you know, you are the expert of your own body. If something doesn't feel right, and this is the confidence building that is needed about trying to encourage people to go and seek healthcare and seek support. Um, and absolutely that literacy needs and numeracy needs and digital should not be a barrier. And I suppose so why is health literacy so important? And we'll have the barriers here in a minute. It is so important because we have some Irish research, and we're going to get some more soon, but we know that 1 in 5 people are not confident that they understand the information they get. So imagine they make it into the appointment. You're there, you're talking to your doctor, your consultant, who, believe you me, I still think the power dynamic is huge there. I mean, whatever Ireland's gone through a massive change in recent years, I think we're getting there with the healthcare sector. But there's, you know, the HSE and the Department of Health have patient and public engagement. There's lots of really good initiatives happening, but patients and public and us need to be much clearer. As we are the expert, we go in and seek, you know, what's wrong with me. If we're not happy, we ask for second opinions. If we are given options, we ask, is there anything else? And then we may need to go and investigate. I mean, one of the best health literacy advocates, certainly of my generation, I believe, is Vicky Phelan. And what Vicky did, separate to the whole circumstances on what happened to her results and all that was that when Vicky did get her shocking diagnosis of how terminal her cancer was, she said, and this is in a Miriam O'Callaghan interview, if anyone wants to listen back, she said, "What are my options?" And the consultant said, "Well, I recommend," it was radical radiotherapy, chemo, whatever the thing. And she said, "No, what are my other options?" And he said, "No, I recommend that." And she said, "I want more than that." And he said, "Well, whatever, good luck." And her thing on the thing, she then went off and did her own research, because Vicky worked down in WIT, as it was known then, in the Literacy Development Centre, and was in her heart and soul an investigator and a researcher. And through her research, she found this drug called Pembro. She investigated that. Then, luckily enough, their funding was available through her claim. But in fact, then through her lobbying, she got that drug paid for by the state, and other women and men possibly on that, because the drug does help different type of cancers, did that. And I suppose I always think of that really strongly, because I think to myself, my Lord, we'll never know, obviously, if she'd have chosen that first option given to her, how long she may have had. But her, by not choosing that option and investigating and finding that drug, Vicky had 4 more years, and that's, to me, is around, you again go back to yourself, seek your advice, and please, on the literacy side, I hope people, and this is what we're trying to break down, and the work we have to do is to try and encourage people, and encourage the healthcare service when they meet people who come in. So I've done many training and there's some fabulous staff. There really are, who will go over and above and beyond. And I suppose all fabulous staff may have come in with the best interests, but they're also humans and their life. And then there are time pressures within the service. So I have also done training where I've had pushback on me. Are you mad, Helen? Do you think I have the time to be asking everyone if they need a hand with the form? In another, I was out in a pain clinic a couple of years ago. "Are you mad, Helen, thinking that I'd ask someone to help them with the leaflet?" I only help people who have grey hair, like my granny, because nobody who's not old couldn't read. Sure, we all went to school and we learned to read. There's no way that can happen. So again, here's
Helen,
bias and myths. Michael, yeah?
it's it. Look, Tony Hoolan wrote a book there, and he was on the Late Late Show there a few months ago, and it really came across to me how he wrote about his wife getting cancer. It was a rare cancer. He's a doctor, his wife is a doctor. And they had to research it themselves because they knew little about it. But they were doctors, and they found it hard to get around it, and they had heard of it, and they wouldn't have dealt with it in their professional life. And it just came across to me that they're two professional people. And Tony made a reference that he had a friend, the doctor is in Vincent's, that he consulted with him to get a bit of information. You put me in that situation, I'd have no hope. But they came from the background, and they were still struggling at the time, and his wife and all that was going on. But it just made it so, it's all about just, we need somebody to explain in them. And that was some example for me, because I said, Jenny, God, that man struggled because of his wife, and they understand it, and they had to learn so much about it. Fascinating. It was just fascinating. And it says, then I flip it over, people that don't have the education they have, they'd be totally lost.
Yeah, and that's why we really do need the health. You can't rely on everyone having, and I say that from a space where my own confidence when I deal with healthcare professionals, it goes out the window. You're if you're sick or you're anxious about the thing. I mean, in my example, recent enough, when my daughter needed her, it was wheezy, she's asthma, went in and was at the GP. She said, "Oh yeah, 10 puffs, 10 puffs." I was like, okay. I went to the chemist, and we were getting the inhaler, and 10 puffs. And I looked at the pharmacist and I said, "Well, what happens if the 10 puffs don't work?" And the two of us were looking at each other, was going, she says, "Hold on." And we rang back over to the GP. And of course, the answer was, if the 10 puffs don't work, you get her into a car and you go straight to A&E, or you get there. But again, I just think it really is fascinating. We all think we're prepared, not when it comes to healthcare. And Stephen Donnelly spoke at an event I was at recently, and the minister said himself that if any of his family members are going into health appointments, and particularly for health results, he says to them what we and NALA have been saying for years and years, which is bring an advocate with you. please, if you have somebody, nobody should be going into appointments on their own to get results in particular, because you're never going to take it in. You need another person there with you to do that. But look, I know we're running
Helen,
out and we've
can I,
minutes.
yeah, just let you know, we've about 2 or 3 minutes left. So maybe you just, Helen, pick 3 or 4 slides that you think are key and ask Derb to go on to those.
Yeah,
that's
sure.
okay.
So that's great. Derb, if you just want to, and as I say, Fergus is going to send these to everybody, so that's
Yes.
fine. So we move on from that one just to share with people, I think, about supporting needs. So the next one I think is important, which is about the adult literacy service itself. So if through your work, people here working with your own clients and your own participants in communities, come across anyone with literacy needs. So me and Michael have been around the houses for years doing talks, thankfully face to face, initially, pre-COVID, and then the online, but it's working okay. We always come across people who want to share their story after we do this. And I know somebody, my uncle John, my neighbour, mum, dad, whatever. So just to say, where would people go if they needed to get some health literacy support themselves? So if you come across anybody, the local education training boards, the ETB, this is our local service. They are highly trained, funded, free. It's absolutely a space. There's 100 adult literacy organisers. So just you can Google that, find out where they are, and do in that way. Then NALA have the free phone line, I think is important there, even before there is supports like Learn with NALA, and you can work with tutors over the phone or whatever. But the initial way into that, if anyone is nervous or what'll I do, ring the free phone line, someone will chat to people. So we'd often have people who ring and say, God, I've just been diagnosed, for example, with diabetes. And there's an education diabetes course I have to go on, and I'm worried about that. And will there be reading? Will they ask me to write? Will I be asked to speak out loud? So sometimes it's just allaying fears of that for people. And then just saying to them, look, maybe you could chat to the facilitator before, say to them, not great at that. I'm not comfortable with that. Don't even disclose your own skill needs. Just say you're not comfortable with that. And that's a way around that bit. Great. So Derv, the next one then, I think is looking a little bit at and the next one again is the Adult Literacy for Life strategy. So again, just even to reiterate to people that the government and NALA lobbied really strongly for this, was to get a 10-year strategy in place. Strategy's there now. There's a programme office living over here in Solis, the Further Education and Training Authority, and there's a director and 5 leads. I'm over as health lead. But what I think is important just around, and we will look at what we'll do in a minute, just is that the minister in that report did, for the first time in one sense, it's nearly like an apology to people, but to be very clear that anyone that we meet, and it is really important with literacy needs, it is not their fault. Right? This is something that has happened to them because somewhere along the line, the systems, the schooling, the structures didn't succeed for them, and the state failed for the people on that. I think that is really, really important for anybody that is that stigma and shame that Michael mentioned. We have to sort of allay that and say, no, this is about now. What can we do and support you as you move on? And the last one then really, Derv, is probably just that I'll finish on, is the one with the policy practice, and there's loads of other bits in there that you'll see, guys, around the strategy. But if you move it on to the, I think it's about 3 or 4 down the line, it's the one on the policy and the practice and the thing. So there's coordinators there. That one, just the one there before that one there. There, the policy, practice, and people. So on that one, this is where we are trying to engage, just the previous one. We're trying to look at what are the policies that are needed around health literacy, working with the Department of Health, putting places in. We're going to look at practice, so working with the HSE, improving plain language, training for staff, really trying to build on that. And then working with people and communities, really. So do we need a health literacy course for the public? What would that look like? Do we need a specific health literacy campaign or messaging that goes into their broader campaigns? And then champion. So Michael's a champion. We'll go on our champion mode. We need more Michaels, and we need to hear those voices where people are telling us things that didn't work. And I also want to hear things that are working, because there's a lot of really good stuff that is working in the health service, and we tend to only hear about the bad stuff. But I want to know the bad stuff, because by knowing the bad stuff, we can hopefully make it not happen again. But there is some really good stuff, and the staff, with limited resources often and time, and what we can offer them now are things like training and resources, and have an even better service where anyone, regardless of their skills will get a good health service, and hopefully, as we say, keep healthy for many years to come. So, and all of the slides Fergus will send you, and there's details and contacts in those.
Yeah. Helen, thanks so much, and apologies to everyone that we sort of ran out of time, but it was an absolutely fantastic webinar. It was so inspiring, enriching. Helen, there was so many good tips there and suggestions and ideas. And as Helen said, I've recorded this, so we'll send it on to everyone, and we will also send on Helen's slides. So she didn't get to all of them, but you can see them. So it just leaves me once again to say thanks again to Michael. As Helen said, he's a champion. We need more Michael, she said, and that's true. So thanks, Michael, for your personal and professional inputs on health literacy and the importance of it. It was really inspiring stuff.
Much.
And thanks so much, Helen, for all the information. And anyone, if they need to get in contact with Helen, can email me, or if they don't have Helen's contact details, and I can forward it on to Helen if you need anything done. So thanks everyone for joining in. Thanks, Der, for all those technical help. I would have never thought of getting Helen's slides up like that. So thanks for that. So, and thanks everyone for tuning in, and have a good weekend. Bye. See ya.
Thanks.
Bye.